السلام عليكم. في ميلي للمحاضرة الثالثة للباثولوجي infectious diseases. باستمرار لتكمل المحاضرات السابقة فيما يتعلق ب bacterial infections pathology. Actinomycosis is disease caused by Actinomyces israeli. هذه البكتيريا هي عبارة عن anaerobic bacteria and gram-positive bacteria that stain with the gram-stained bluish stain and appear as long filamentous bacteria. الجروث مالتها تكون على شكل جروث خيطية، بكتيريا خيطية. These microorganisms are part of the normal common microorganisms present inside the body, and they are found in the mouth, in the GIT, and in the female genital tract. Under certain conditions, they proliferate and invade the underlying tissue and cause disease. So they present mainly with the mouth disease in the head and neck region, in the neck, in the mandible, and this is representing about 70% of the cases, or may present as disease in the GIT or in the female genital tract involving the uterine cavity, and this represents the minority of the cases, that is 15% of the cases. Regarding the pathology and macroscopic and microscopic picture of actinomycosis, here infection by actinomycosis usually producing mass-like abscess. The abscess is formed of multiple abscesses fused together تنتبه مثل honeycomb appearance to the abscess, and these abscesses surrounded by fibrous wall. Inside their cavities they contain the colonies of the microorganisms, تجمعات من الميكروorganisms, and these colonies of microorganisms appear as yellowish granules عبارة عن حبيبات صفراء والتي أخذت الاسم sulfur granules. They are not true sulfur granules, but their appearance is similar to the sulfur, and so they are named as sulfur granules. These abscesses usually open to the surface of the skin or to the inside of the oral cavity by multiple sinuses and fistula, and the pus material along with such granules pass from such openings, fistula and sinuses, to the outside. Remain a characteristic feature for this disease. Under the microscope, these abscesses are formed of multiple abscesses composed of central collection of pus material, bacterial colonies, and surrounded by granulomatous inflammation and fibrosis. Then, under the microscope, there is a chronic granulomatous inflammatory reaction associated with suppuration, pus formation, and bacterial colonies. These are surrounded by granulation tissue and then by fibrous capsule. This is the gross appearance of actinomycosis, representing the skin. There is a swelling large mass with the swelling of the skin, involving multiple these openings, these multiple sinuses and fistula opening to the outside. Under a microscope, we see bacterial colony formed of gram-positive filamentous bacteria surrounded by granulomatous inflammation and granulation tissue and a rim of neutrophils in contact with the bacteria. Another picture of actinomycosis, we see in the center a gram-positive filamentous bacteria of actinomycosis. The peripheral rim تنتبه تكون eosinophilic in appearance and club shaped شكله يكون arrangement مثل المضرب. This is surrounded by a rim of neutrophils, this representing a neutrophil rim, and then granulomatous and granulation tissue reactions surrounding it. Regarding another type of bacterial infection is caused by Spirochetes. From its name, Spirochetes, these bacteria are characteristically spiral in their appearance. And the best example of this is the bacteria that causes syphilis. This bacteria, the cause of syphilis, is a Treponema pallidum, subspecies pallidum, but usually we call it Treponema pallidum. This is a chronic venereal disease. It's chronic, not acute. That takes long time period or long course, and venereal disease that is transmitted usually by sexual contact. The microorganisms of syphilis are gram-negative microorganisms. When stained by a gram stain, they appear red in color, and they are coiled, spring-like, and they are unicellular, composed of single cell. يعني ما multi cells بتتش together تعمل الcoil appearance for it. لا، إنما single microorganism, single cell microorganism that form a coil appearance. Regarding the transmission of syphilis, syphilis is usually transmitted by sexual contact. However, another way for transmission is through the pregnancy, when infected mother transmits the disease to her fetus through a transplacental spread and cause infection to the fetus. This causes congenital syphilis. Regarding the stages of syphilis, syphilis has three main clinical stages. The first one is primary syphilis, second one is secondary syphilis, and lastly is tertiary syphilis. In the primary syphilis, here the infection for the first time, the patient has no immunity before and no disease before, and usually the patient get a lesion at the site of entry of microorganisms. The microorganisms at site of contact usually penetrate the mucosa or the skin and start proliferation at the site of entry, producing many bacteria at the site of entry and producing lesion, which is elevated lesion called chancre, which is characteristic of the primary disease. Then this takes weeks to heal, and after weeks there is development of secondary syphilis, and the secondary stage is characterized by palmar rash, macular rash, red rash involving the palms of the hands and the soles of the feet, associated with generalized lymphadenopathy, enlargement of the lymph nodes all over the body, and papular lesions called condyloma latum that occurs at moist areas of the body, such as axillary folds, inguinal folds, in addition to development sometimes syphilitic neural disease, which is usually asymptomatic. Then the patient passes to a latent period. All of these heal and pass to latent period, which takes about years, sometimes ما بين 5 سنوات إلى 30 سنة أو أكثر، يعني decades. And then there is development of tertiary syphilis. Tertiary syphilis is usually involving either the CNS or the CVS, or with spread lesions involving other organs or combination of them. In the CNS, usually the patient develops abnormality in the CSF fluid composition, or sometimes meningovascular disease or lesions gamma in the brain, or even paralysis and paralysis. In the aorta, the patient develops aneurysms in the proximal part of the aorta and associated aortic regurgitation. Whereas gamma usually develop in other parts of the organs of the body, including the skin, bone, or even liver. Regarding the primary stage, as we said before, the lesion, main characteristic lesion is called chancre, and usually develop a few days to few weeks after getting infection with the microorganism. These lesions usually found at external genitalia, usually of both male and female, and this lesion chancre is composed of solitary lesion, slowly enlarging and painless nodule that sometimes ulcerate and associated with just regional lymph node enlargement. يعني in primary syphilis there is chancre plus sometimes regional lymph node enlargement اللي هو surrounding the chancre area, and this usually heals within تقريبا شهر with spontaneously or even after introduction of antibiotic. Regarding the secondary syphilis, here usually develop after the primary syphilis by about 1 to 3 months, and it usually seen in about 75% of patients, of untreated patients. The lesion appear as, here characteristic lesions in the secondary syphilis include flat lesions or papules that develop in the external genitalia. The buccal lesion, the mouth, lingual, and pharyngeal area should develop ulcerations, and there will be development of skin rash, usually maculopapular rash, sometimes associated with pustule formation and pus formation, and there is development of generalized lymphadenopathy, enlargement, painless enlargement of lymph nodes all over the body. And here in this stage, usually also healing occurs either spontaneously or even after introduction of antibiotic. The third stage of syphilis, here the tertiary stage, and we said that it develops several years after the primary infection, and usually takes about 5 إلى 30 سنة as a range, and the patient develop either cardiovascular syphilis or CNS disease or gamma. In the cardiovascular syphilis, the patient usually develop aneurysms in the proximal part of the aorta. This aneurysm is due to inflammation, vasculitis of the vasovasorum that responsible for the supply of the tunica media of the aorta by blood. وهذه كان ختمه بالهيستولوجي بأن الفازوفازورم هي المسؤولة عن تزويد الفيزلز with blood اللي هي small blood vessels موجودة بالadventitia of blood vessels. When they are develop vasculitis, they are closed, and so there is decrease in the blood supply to the aorta, while subsequently there is fibrosis of the tunica media and weakening of the valve of aorta and development of aneurysm, اللي هو dilatation of the aorta. Such dilatation of the aorta associated with dilatation of the ring of the aortic valve, ولهذا the patient develop aortic regurgitation. Regarding gamma usually تكون multiple yellowish tan masses, nodular masses. Their appearance similar to tumor and can be developed in the liver, in the bone, or in the testes. And under microscope, these gamma are composed of granulomatous inflammation, central coagulative necrosis surrounded by granulomatous inflammation. The histology of syphilis, usually there is mononuclear inflammatory cells infiltrate at the site of the lesion. يعني there is lymphocytic infiltrate and very much plasma cell infiltrate characteristic for the lesion. Associated with the blood vessels inflammation, that is vasculitis. فإذا the main characteristic feature is plasma cell infiltration and vasculitis. The type of vasculitis in syphilis is called proliferative vasculitis, proliferative endarteritis, or sometimes called endarteritis obliterans. يعني there is inflammation of the blood vessels associated with obliteration of the lumen. So there is obliteration of the function of the blood vessels and loss of function. Under microscope, these blood vessels, they have endothelial cell proliferation, subintimal or intimal fibrosis, and then there is surrounding plasma cells infiltration. These vasculitis and mononuclear infiltrate are found in all stages of the syphilis, and can be found at the primary stage, either at the secondary stage, and in the tertiary usually you find gamma. This also can be found. This is a photomicrograph of syphilis. We notice this is a skin, squamous epithelium, and in the skin these are small arterioles surrounded by a dense mononuclear infiltrate and plasma cells. فإذا these are blood vessels, هذه blood vessels, وsurrounding مالتها عبارة عن inflammatory cells mainly composed of plasma cells اللي قلنا eccentric abundant eosinophilic cytoplasm. After time, there is a proliferation of endothelium, fibrosis يؤدينا إلى obliteration of the blood vessels, وfibrosis يؤدينا loss of function of blood vessel. This is a lesion of syphilis characteristically by infiltration of much plasma cells, eccentric nuclei with cartwheel appearance for the chromatin, and abundant eosinophilic cytoplasm surrounded by here perinuclear pale area, of Golgi apparatus. The other one is that congenital syphilis. This means the fetus develop infection during his life in pregnancy, during pregnancy life, and the patient usually, the child develop the infection, the fetus develop infection usually when the mother has a primary or secondary syphilis. The microorganism is high level in the blood, and they are transmitted through the placenta to the fetus. So the clinical presentation, how does congenital syphilis present? It presents in three patterns. Either during pregnancy there will be abortion and stillbirth, and usually occurs late in the pregnancy, that is during the 6th month of gestational age. The other one is that the infantile type. Here the infantile type usually developed during the first 2 years of life, عمر سنتين تقريبا، يعني أول سنة سنتين. Here the child develop rash, macular rash all over the body, osteochondritis, inflammation of the osteochondritis, bone and joints, periostitis, inflammation of the superficial layer periosteum of the bone, and liver and lung fibrosis. Osteochondritis and periostitis, they are responsible for bone changes and usually involve the nose, the bridge of the nose, أدينا إلى appearance saddle nose, damage to the bridge of the nose. أيضا they involve the tibia, the perforation of the periosteum, تدينا إلى subluxation. The liver and the lungs of these infants usually develop much fibrosis, and subsequently there is decrease in their function. Whereas in childhood, that is tardive syphilis, which usually occurs by the 2 years of age. Here, the child will develop interstitial keratitis, that is inflammation of the eye cornea, and this is associated with development of blindness. Hutchinson teeth, the teeth in congenital syphilis on a small size, screwdriver-like appearance, notched teeth, development of eighth cranial nerve abnormalities, disease يؤدينا إلى deafness. فإذا childhood syphilis, there is blindness, deafness, and abnormal teeth. This is tongue with multiple ulcerations found in patients with secondary syphilis, and this is appearance of teeth in congenital syphilis. We see they are notched teeth. اسمه Hutchinson teeth. Diagnosis of syphilis usually results in a combination of history and examination and investigation. In investigation, here there is detection of the Spirochetes, the microorganism, that is Treponema pallidum, and we usually do not use gram stain because the microorganism is slender, thin, that cannot be detected in gram stain, not easily detected. فنستخدم silver stains or dark field illumination, or sometimes immunohistochemistry or immunofluorescence. Other tests in serological tests for detection of responsive antibodies, and PCR test for the detection of microorganisms. This is tissue stained with silver stain, and we see thin spiral filaments present in the tissue. These filamentous bacteria, spirofilamentous bacteria, is spirochetal microorganisms of syphilis. Treponema, we see that they are twisted microorganisms with a spiral appearance. This is dark field illumination for detection of microorganisms. We see they are spiral appearance, have a spiral appearance, twisted microorganism, long, thin, and twisted appearance, appearing as yellow color. Regarding viral infections, viral infections is caused by microorganisms اللي هي viruses. Viruses, they are small microorganisms. They are obligatory intracellular microorganisms, يعني they live inside the cells وليس found outside the cells, and they are classified حسب structure مالتها nucleic acid into DNA viruses that contain DNA and RNA viruses that contain RNA لكن مو اثنيناتهم سوية. How viruses cause injury, cell injury, that is mechanisms of viral injury. The virus will enter to the inside of the cell in the human being to produce injury by certain effects. First one is that inhibit the cell DNA, RNA, and the protein synthesis. Then, when enter to the inside of the cell, prevent the cell function from synthesis of DNA, RNA, or even a protein synthesis. And this is best example seen in poliovirus when infect the neural cells. They affect the function of the neural cells and producing paralysis. The second one is that by direct killing of the cell or host membrane, that is damage to the cell membrane, damage to the DNA, and this is found in measles viruses when cause lysis of the cell of the human body affected by measles. The third mechanism is by also lysis of the host cells when virus replicate inside it. And the fourth one is that by, not the virus itself, by the virus induce immune reaction against the cell infected by it. Example of it is that when hepatitis B virus causes infection of the liver and express viral antigens on the surface of the liver, the immune system will react against them. The fifth mechanism is that the virus damage the host defense mechanisms. Here, best example in HIV, when infect the lymphocytes, CD4 helper lymphocytes, and impair their function, so impair the immune reactions of the body. And lastly, the virus will induce cell proliferation and transformation. Here, best example is seen in human papillomavirus when infected the skin, producing warts. Also, human papillomavirus when infect the cervix of the genital tract, producing cervical carcinoma. And another example of this is hepatitis B virus when infect the liver cells, may lead to development of liver carcinoma, that is hepatoma. This is a scheme representing how the virus causes cell injury. That is when the virus get to the inside of the cells, it attach to a receptor, sometimes special receptors for it, and get to the inside of the cell. Once they get inside of the cells, they release their genome, whether DNA or RNA, and this genome is integrated to the genome of the cells, and then the virus reduces its effect. It either reduces the DNA or protein synthesis, as we said before, or sometimes there is induction for the proliferation of the virus or production of viral proteins and viral copies, and this aggregate inside the cell, whether in the nucleus or in the cytoplasm, as viral inclusions. Or sometimes the virus, there is a symbol of the virus and formation of new viruses, and these viruses, they rupture the cells, lyse of the cell, and get to the outside and infect other cells. Or some of the viruses, they express viral antigen on the surface of the cell, which induce an inflammatory reaction against the host cell that contain the virus, as in case of hepatitis B virus, hepatitis B, or as we said before, there is a neoplastic transformation of the cell, and this is seen in many viruses. Another example of this is EB virus, the development of nasopharyngeal carcinoma, or human T-cell lymphoma virus, responsible for the development of lymphoma. Or there will be cell fusion, cell lysis and damage of the cells, release of the virus, or impairment of the metabolic function of the cell. Under the microscope, when there is viral infection, we see usually mononuclear cell infiltration, that is reaction by lymphocytic cellular immunity against the viruses. There is many lymphocytic infiltration in the at the site of infection. We see tissue necrosis as a result of inflammation and viral infection. We may see sometimes giant cell formation, diffusion of multiple infected cells together, results in formation of multinucleated giant cell. Another feature is that we see multiple inclusion body, that is presenting viral particles and proteins inside the cell. They may accumulate either inside the nuclei, producing intranuclear inclusions, or in the cytoplasm, producing cytoplasmic viral inclusions. Here there is example of dorsal root ganglion infected by varicella zoster virus. The ganglion shows necrosis, necrotic changes. There is a fragmentation of the nuclei and necrotic debris surrounded by an inflammatory reaction rich in lymphocytes. Here, an example of measles, there is development of multinucleated giant cells. This is giant cells with multiple nuclei, in addition to presence of intranuclear inclusions. This is a xenophilic body inside the nucleus representing viral particles presenting as an inclusion, which displaces the chromatin to the periphery. viral particles داخل النيوكليوس تدفع الكروماتين إلى البريفري of the nuclei and appear as xenophilic material inside the nuclei. This is another example of herpes simplex virus. In the blister we see أيضا intranuclear inclusion, هذا homogeneous body representing viral inclusion inside the nucleus, while peripheral diagram representing residual chromatin that is displaced to the periphery. Another example is cytomegalovirus infection of the cell in the lung. We see this is epithelial cells, pneumocytes of the lung. Epithelial cells has been infected with virus. This is a nucleus, and this is a viral inclusion, large viral inclusion surrounded by clear halo and multiple small dot-like blue inclusions present in the cytoplasm. Now, how the body responds to viral infection? That is when there is viral infection in the human body. What occurs inside the body? First of all, there is lymphocytosis that can be detected in the blood, examination of the complete blood picture. And there is a production of neutralizing antibodies that will neutralize the virus when present in the bloodstream, and they prevent the second infection, development of immunity. And there will be development of cell-mediated immunity, which plays a role in controlling the current viral infection and damaging the viruses. And there will be production of interferon by the lymphocytes to enhance immunity and defense against virus. The type of viral infections, the viruses either produces acute transient infection, as in case of flu, a common cold usually takes 2 to 3 days and they'll resolve, or they produce latent infection, that is after an infection, the virus present inside the human cells in a persistent way, and the viral genome is still inside the cell and they do not cause the disease, but after a long period of time there will be reactivation of the virus and they produce disease. For example, of varicella zoster, after the infection, the virus get and settle inside the ganglion and remain there dormant, latent, doesn't produce disease. But under certain circumstances, there will be activation and the virus is transmitted along the nerve and produce disease. Another pattern is that there is persistent infection. Best example here is when hepatitis B virus infect the liver. They produce disease over a long period of time that takes years, sometimes يمتد إلى طول العمر, this is produce chronic inflammation in the liver surrounded, resulting in regenerative nodules and fibrosis, resulting in the end of liver cirrhosis. Other viruses they transform the host cell into tumor. هذا تكلمنا عنها سابقا, مثلا human papilloma virus اللي ينتج لنا wart and cervical carcinoma. And thank you.